Hi, Brandon. I'm Anthony. It's nice to meet you. I'm a DPD student out of the St. George pathway. Sorry. So I'm just going to start with the questions. You said, tell me a little bit about my field of work. So physical therapy, focused on movement, rehab, pain management, overall long-term function, um, dabble in motivation. Basically, we're just interested in human movement, exercise science, strength and conditioning, all that stuff, kind of rehab techniques, trying to help people regain independence. Um, so what moral standards or functional principles direct my day-to-day work? Um, Overall evidence-based care of clinical reasoning, obviously, but with that being said, trying to do no harm and all the other ones like empathy, honesty, transparency. So sometimes, um, we alter plans of care to more better suit certain patients. Um, Overall, the goal is patient autonomy and dignity, trying to support the patients. Oftentimes, especially in the hospital setting, they can be, down on their luck a little bit and, can need a little bit of motivational support so that we can kind of provide that for them. Examples of interprofessional teamwork, successes and failures. Um, Successful examples are when kind of that interprofessional collaboration works well, that doctors, the OTs, PTs, nurses, case managers, that whole team works well. They all communicate well, they all support each other, they all like verbally and you know with their time as well. A bad example would be a lack of following through uh, with certain, providers or patients even. Um, you know, if you're unclear of roles, that'll really hurt the, that healthcare alliance. If people make assumptions, that can also hurt that alliance. Examples of failed teamwork with another discipline. What were the issues and how would you handle it? I haven't seen this too much. The only time I've seen this myself is working in an outpatient physical therapy clinic. Oftentimes, the doctors, the surgeon will have a specific plan of care that they um, dictate, and that may not suit the patient very well um, due to where they're at in their progress. So it might be better to communicate with the doctor in that scenario that, hey, maybe we need to readjust the plan to kind of better suit this patient. They maybe not be as far along, they may be farther along. Um, Another challenge could be a lack of clarity, kind of no shared, you know, platform of priorities, if you will. Like everyone should be aware of their priorities, their roles, their, in that therapeutic alliance, if you will. What character traits are necessary for effective teamwork? Humility, having good communication skills, being someone who's flexible, obviously someone who's very emotionally intelligent, someone who can, be able to listen to someone else's perspective. Listening is a big part to this whole process, being able to listen to somebody else. And staying respectful. If you have evidence or you have an opinion that you want to share, you still want to be respectful in that process. um what I like to learn from Brandon, or sorry, what would I like to learn from you, Brandon? I would like to continue to hear your perspective on acute care, from the physical therapy side of thing. The biggest thing we rely on you guys for is medications. So, if I'm going to go in for therapy, it's the most beneficial if a patient gets their medication hour or two before their therapy. That way they're the most, cooperative and we can get the most done in our session. That's the biggest thing. But other than that, just overall working together well, keeping, I have to update the vitals when I'm working with the patients, and I know that I've seen in the hospital setting where that can be let out to dry. Sometimes the PTs don't do such a good job on that, so that's something to really pay attention to. Um, and just overall communicating well with, and learning what you guys need from us, if that makes sense. Because I think what we need from you. Um, so it'd be nice to kind of hear from you what you clearly would like, what you know what I mean, what